Welcome to our lecture on shock, its types and their characteristics. Let's define shock as a state of cellular and tissue hypoxia due to various factors. Shock can arise when there is a disturbance in the delicate balance between oxygen demand and supply within the body. It can result from reduced oxygen delivery, increased oxygen consumption, inadequate oxygen utilization, or a combination of these factors. It is a critical condition that requires prompt recognition and appropriate management. Now, let's discuss the different types of shock. Shock is broadly classified as distributive shock, cardiogenic shock, hypovolemic shock, or obstructive shock. Distributive shock, vasodilatory shock. This type of shock is characterized by severe peripheral vasodilation, leading to a decrease in systemic vascular resistance. Distributive shock can be caused by various conditions, including septic shock, systemic inflammatory response syndrome, SIRS, such as pancreatitis, neurogenic shock, anaphylactic shock, toxin-related shock, and endocrine shock like Addisonian crisis. Cardiogenic shock. It arises from intracardiac causes of cardiac pump failure, resulting in reduced cardiac output. The causes of cardiogenic shock can be cardiomyopathic, such as myocardial infarction, or due to arrhythmias like sustained ventricular tachycardia. Mechanical abnormalities like acute valvular rupture can also lead to cardiogenic shock. Hypovolemic shock. It occurs due to reduced intravascular volume, specifically reduced preload, which subsequently decreases cardiac output. Hemorrhagic causes, such as trauma, and non-hemorrhagic fluid losses, like diarrhea, can contribute to hypovolemic shock. Obstructive shock. Obstructive shock primarily stems from extracardiac causes of cardiac pump failure and is often associated with poor right ventricular output. It can be pulmonary vascular related, such as in cases of pulmonary embolism, or due to mechanical causes that reduce preload, like tension pneumothorax or pericardial tamponade. Conclusion. Shock encompasses a state of cellular and tissue hypoxia resulting from various factors. We have discussed the types of shock, including distributive shock, cardiogenic shock, hypovolemic shock, and obstructive shock. Understanding these types and their underlying causes is crucial for timely recognition and appropriate management. By staying informed, we can improve patient outcomes and make a positive impact in the field of medicine. Thank you for joining us.